Hello.
Hi.
Hi, how are you, Astari?
Oh my God, I'm fine. And how are you, Tarana? I cannot see your face. Please show me.
Can you
I
see
really miss
now?
this face. Yes, I can
Okay.
see now. And that's horrible. You know, it's like it's like
Your one is not that good also,
oh
okay?
my. Okay, yeah, well, I can accept that. You always say that to me. You know?
Mhm.
Oh my God, it's been like almost a decade since the last time we met in the Netherlands.
Yeah, yeah.
That was the last time when you accompanied me to the station, and then that was our farewell. You remember what the last time you say to me? Astari,
No.
if I get married, please, I don't care what your reason, no matter what happened, no matter where you are, please come to Bangladesh and see me as a bride. And that
Okay.
never happened until this time. That never happened until this time.
Yeah.
Why? So it's
Okay.
oh my God. Okay.
Maybe I'm waiting for you to get the visa. So as soon as you get the visa for Bangladesh, I'm getting married. I don't know whom, but I'm going to.
Oh my God. Getting a visa is it's just an easy thing.
Really?
It's
No,
in
not
Bangladesh.
really.
It's still Asia. It's still Asia.
Yeah, but there are many, now. Okay, I don't want to talk about this.
Okay, me too. Me
Yeah,
neither. Okay.
yeah,
So don't forget about the topic today.
yeah.
Well, I'm
So,
going to polite. You listen. I'm going to polite to you. This is rarely happen. I'm going to polite to you. How
yeah, I know.
how are you? How are you actually?
Um, this is a very, difficult question to answer right now. That
Okay.
how, because everywhere we know that what is happening, so confined in a home for like more than 2 months, not going outside for a single time. So it's, and also, I mean, the whole lifestyle has changed.
So, when was the first time in Bangladesh the confirmations of the positive COVID, the first case? It was
I
in
think
around February or March.
no, it's in March.
March.
Hmm.
So it's the same case in Indonesia. The first case in Indonesia was during the first week
Hmm.
of March.
Yeah.
Yeah.
So I think it's second week in March in Bangladesh, second or third. So I don't remember the exact date, but it was in March. Yes, and also the government take the initiative to lock down and announcing the holidays for all from the schools were closed, all the offices, government, non-government, everything was closed, and but the lockdown was really effective for first few weeks, but
So it was
then
effective. You said it was effective.
it was initially,
Okay.
but now, although I think it is going to be, I mean, the lockdown will be over from next week, maybe. I'm not sure yet, but for last few weeks, people were not, they were not following it as they were following at the very beginning.
Okay. Tarana, you tell me the first cases in Bangladesh of positive COVID. It was imported cases, so or
Yeah,
not? I mean,
yeah, it
yes.
was. Yes, so
So not a.
someone
So, huh?
someone came from Italy. He, his wife, and somebody else from the family or someone else's family got infected. So the first three cases got identified in the first day of March, the first day of the identification.
The first case in Indonesia was Indonesian people,
Hmm.
but she had meetings, actually dance in the night with friends from Japan.
Okay.
And then shortly after that, she was confirmed as positive COVID, and also the mother of this girl was also
Hmm.
positive
Okay.
because they live in the same house.
So did you do the contact tracing?
We do,
Okay. So is it
yes, we do.
effective?
Your question is actually very difficult to answer. I'm not. You're a researcher, so your question is a very research based. I'm
Okay.
sorry,
Okay,
Tarana. You
sorry.
know,
I should talk like a general layman, right? Okay.
Oh, thank you. That's really helpful.
No, but continuously working, and then it feels like whatever I'm saying is very normal. But then you reminded me that no, I am not. So sorry, but
No.
yes, please just tell me if something is not very, I mean, understandable to you. If I'm using any word from which is very much used in public health but not understandable by people, other, I mean, normal people, then yeah, just
Yeah.
remind me. Yeah.
Okay. Well, Tarana, please let me welcome our viewer here. I'm so
Okay.
thank God that there are several viewer here, and I'm going to tell them that
Hi.
Tarana Ferdius is my friend, best friend. Okay, it's really hard for me to say that actually. In the slide here, it's really, oh my God, it's really hard feeling, but that's the fact. So she's my best friend. We always discuss, and
Hmm.
she's Bangladeshi. So
Yeah.
Tarana Ferdius is a pharmacist. She's a very good pharmacist and dedicated in research. So a pharmacist doing research in public health. So actually she's brilliant. That's why I always love her. I always love to have a conversation and discussion with her about everything. And now you are also doing research in public health, right? In your
Yes.
country, in Bangladesh.
Yes, I think I'm pretty much away from now pharmacy line, and now I'm mainly working in public health. So my most
Okay.
of my work research is related to tobacco related. So tobacco control and secondhand
Okay.
smoking, passive
Mm-hmm.
smoking, so something like these, and also randomized control trial and intervention studies, as well as I'm also working for some qualitative resources, and that is focused mostly about the health system.
About the health. Yeah,
Yeah.
Tarana, you've been going around the world. I see in your profile picture that you put almost all the flags in this whole world, the countries in this whole world,
No, not
and
all.
it's a pity, that Indonesia was not there yet. I don't know why. So
Okay.
so you see, very much different health system all over the countries around this
Yeah.
world. Uh, How do you see, Tarana, this, you as a pharmacist and you as a researcher in public health? The health
Well,
system, is it really, no, I mean, my question is it really, in the end, something to do with this pandemic or not?
I mean, you mean your question is if pandemic and the health system, are there any relation
Yeah,
you want to talk about or know
yes.
about? Okay, so yeah, I think the health system is a very important part I mean, they are playing a very important part in this pandemic. If you, I mean, although you said I have seen many health systems around the world, but this is not true. I think I'm only, I mean, I came to know about the one of Nepal and also
Okay.
Vietnam, because those
Vietnam.
were, there's the multi-country research I was involved with. So, but not only from my research, but I've been following the news around the world. Even the countries like U.S., Italy, though these are developed countries, they are even fighting really with us all the health system thing, and they have all these technologically developed things compared to the low and middle income countries like us, but still they are facing, every day they are facing challenges. So, but I don't know if you know about the Vietnam pandemic situation right now. They are
I was
almost,
about to ask you that. I was about to ask you that
yeah.
because you mentioned Vietnam, and it just crossed in my mind that Vietnam has, we can say, a good strategy, or some, or I don't know what's the term for that.
Hmm. Hmm.
They make successfully ends this pandemic. So,
Yeah.
do you see it in from your perspective? Is it something to do with the health system in there, or maybe more like the people itself, or what?
Yeah, I think both are important factor to be considered. For the Vietnam one, what I can say, what I have learned while working with their health system, um, I found that they have top-down health system. So sorry, I'm again using some public health jargon, so I shouldn't use those. So
Okay.
yeah, I'm really sorry about
Okay.
that.
I'm
Yeah.
okay. But I'm sorry too that I said that you've been seeing the, I mean, many health systems. So maybe I was exaggerating, but I'm so proud of you because I don't have any experience on that. You know.
No, but you have different experiences. So I would also request you to tell a little bit about what you are doing and you're currently
Okay.
doing for my friends and my viewers, those who doesn't know you
Your
yet.
your what? Your fence. Your what? Oh my god. I like that. I like that. Okay.
Yeah.
Okay. Okay. Go ahead.
So you should tell that what you are right now, what you are
Oh,
doing.
that's a question already. Oh my god.
Yeah, yeah, yeah.
So now I'm wondering which one is the interviewer and which one is the interviewee tonight. So
Yeah, just
okay. Okay. Well,
yeah.
actually, Tarana, I'm doing a residency in pulmonology. So
Okay.
it is related to what you are doing. Actually, you are working in the field that has relations with tobacco smoking, and I'm doing residency in pulmonology. So the tobacco is our enemy. That's the source of many problems in Indonesia, many disease problem in Indonesia. So so you name it, tuberculosis, it's lung cancers, a lung fibrosis, ILD, it's, almost
Okay.
all of the respiratory disease is related to tobacco. And now, during this pandemic, this COVID, I don't know whether I'm going to say fortunately or sadly, maybe in between. Sadly, uh, the COVID is a respiratory disease problem. So it is actually our field problem. And as a residency, it is not possible for me to not take part in this management for COVID in this country. And doing residency is working in a hospital that actually a center for a kind of disease. So for instance, if me doing residency in pulmonology, so it means I'm working in a hospital that is a referral hospital for respiratory disease. So it means during this pandemic, it will be a center of one of the center in this whole country for
Yeah.
these COVID cases. So I
So
met them.
so the hospital you are working, so is it only for the respiratory disease or for
Not
or
only
general hospital or general disease?
it is actually a general hospital, but the referral for respiratory disease. So almost all of the cases are respiratory disease. But here also we have cardiologists, internist, surgeon, other specialists also in
Okay.
here.
So I'll have some question related to these, but let's go back to our previous discussion and then
Oh,
I'll
thanks
come to
God.
you.
Thanks God. You know, I always feel like when every time you ask me a question that happened since we were in school in Netherlands, when you start saying, Asari, I have a question for you. I was like, oh, okay, what's going to come out from this little girl mouth? Okay, so thanks God that you still end or pause the question for me. Okay.
Okay. Yeah. So we were talking about the Vietnamese health system.
Yeah,
So
yeah.
what I really want, I don't know much about this, so I'm not going to talk a lot about this. But what I really want to focus on about the Vietnam health system is I was just reading few articles, and also when I worked with them, I found that they have, like, compared to Bangladesh, if I just compared it to Bangladesh, they have they emphasis more on public health. They have a public health university, and the government and the health minister of health and the public health department, they have very good coordination. So these things are absent in my country. So I think
Okay.
this is high time countries like Bangladesh, I don't know about Indonesia, but in countries like Bangladesh should prioritize public health more.
Okay.
So this is one thing I think why Vietnamese health system really worked. There was another thing, as you know, the hand washing is very important for this pandemic,
The hand
and
washing,
it
yeah.
was very important to inform mass people about the hand washing and the reason, and to inform people. So what they did, they used the the TikTok video. This is
The
very
TikTok.
popular. Yeah.
Oh, you mean
So
the Vietnam government make TikTok video for the
they
people?
made a they made a TikTok video that tells some awareness information that how long you should wash your hand and how you should wash your hand, and
And
then
it
they
works.
spread it. Yeah, and so many people who may not heard about this pandemic or something, but they keep hearing, listening this type of TikTok video that it's saying over and over, wash your hand, wash your hand. Then people started, I think, that started being so conscious about why they are saying these. So something is happening, and they were very strictly, strictly following all the government rules and everything. So this is from the government part, and I think from the population part, it was also important because the people from Vietnam, I think they were also obeying all their uh, you know all the instruction they were getting, that keeping the social or personal distancing when they're going outside, not going outside for unusual things, rather than just having food or medicine. I mean, if it is not an essential thing. And also, in Bangladesh, we had this Ramadan and also the Eid al-Fitr. So it was so difficult for some people to make them understand not to go to shopping or do something in my country. So these problems were not in Vietnam. So it's from the cultural side, from the
Yeah.
population understanding, and their, how they follow their rules, obey the government, and also the government health system. I think all of these factors were related. Why two countries are facing two different, the after effect of, I mean, the
Yeah.
not after effect, that the pandemic situation, how they are controlling it.
But we can see that it's already an outcome, right? They did really good, and
Yeah.
they have a good outcome. Tarana, do you know if the Vietnam is a densely populated country or not, compared to our countries?
Not sure, but I think it is not that like many European countries that I mean, it is also difficult for them to maintain that, social distancing. It is, I guess, populated, but I can say not as densely as like Bangladesh. No,
Not as densely as Bangladesh. Okay.
no, Bangladesh is very densely populated.
Wow, that's a really good information for me. I didn't know about that. That in Vietnam, the government made a TikTok for the people, and the people obey that rule.
Hmm.
And but talking about what you just said about the wash the hand, and
Hmm.
people obey that advice.
Hmm.
Actually, Tarana, in some public places in Indonesia, I saw that facility for
Okay.
the water and the soap from the
So
government.
okay. So,
The soap from
has it been installed after this pandemic, or it has been there for years?
No, this it's related to this pandemic, due to this pandemic purely. It's
Mm-hmm.
never happened before.
Okay.
Uh, the government provide that to the people, but because I'm not a researcher and I don't really put some my attention on that. I didn't know about the level of obedience of people, whether they
But
wash their hand.
yeah, but I
Yeah,
can
you
guess
can what?
something from you.
Yeah, okay, okay. Now I okay.
I know.
You
I
no
don't
no no no
think
stop that.
if you are the one who truly representing Indonesian people, I don't think they are following anything.
you know actually I'm good inside. I'm good, but some okay, thanks for that ice. I really thank God. I really thanks for that ice. Inside I'm good, and I hate the people.
And outside you
I
are
actually
not.
thank you for accepting me. Oh my God. Yeah. Okay. But
Yeah, and
it's surely Tarana. But well, let's make a guess. I mean, it's just yeah, it's it's just a gambling. Will you say if your people in your country in Bangladesh do the same thing as the Vietnamese people, would be the different story in your country now or not?
I think first I think what we should have done initially was the border closing. So this was not done, and quarantine people at the very beginning, that was not done also nicely. So this is the problem, that now we are facing all this. So I think for Indonesia, sorry, for Vietnamese, they did really follow and strictly did the quarantine and the lockdown, everything, the border closing, everything, and we didn't do the initial
That.
things. Yeah, no, we didn't do. Yeah, so this is I think, yeah, we would have some different scenario if we would have done the same as Vietnamese.
Tarana, I have a graph
Hmm.
about the situations of confirmed cases in Indonesia. If would you love to see? Just
Yeah, sure,
just for your information.
sure.
It's, I don't know how to call this pattern actually.
You should show
So
it
it's so
you
it's
know,
so it's
horizontally.
someday it increases and another day decreases and then increase again, and I don't know what's the actual pattern of this, and lately
Okay.
it's increased significant, very
So is
significant.
it the positive cases in Indonesia?
Yeah, yeah, it's confirmed cases. So read it, read it.
Okay.
Kasus, read it. Kasus.
How am I supposed to understand your language? Anyway, okay. So, do you
So
want to
it's
see?
almost 22. So it's
Yeah.
almost 22,000 cases in
So,
Indonesia with 130 and 300 something death case
okay.
by
So,
now.
this is really. I mean, I'm really surprised to see, but I can show you our this one.
Oh,
See, in Bangladesh, it's
okay.
just, it's just. This is the confirmed cases, and you can read it.
Okay, really? Oh, you know that I can read. Thanks.
Yeah. So that's the pattern you see. It's just increasing.
Yeah, it's increasing.
Yeah.
So
So
it's I see 1,975. That is in a confirmed cases in one
for
day.
yeah, for
One
one day.
day.
Yeah, 24
Oh,
hours.
and that's from all over the countries.
Yeah, from all of the countries.
Bangladesh is a one land, right? One land countries,
Yeah, yeah, one
not
land.
not
Not
not separated by the sea like Indonesia. Because in here in
no,
Indonesia we have several islands separated by the sea, and different region, different cases, different pattern.
really. So
Yeah.
is there any understandable pattern in any different regions of Indonesia?
Maybe there is something understandable pattern, but maybe it's me who do not understand that pattern actually, Tarana. So I'm sorry, I cannot explain that to you. I'm very sorry. Sorry. Okay.
Okay, so a friend from mine asked, what is the total number of tests versus number of infected
Oh
person in
yeah.
Indonesia? So,
Well,
do you
yeah.
have any
The
idea?
infected for the infected person proven by the positive result from the swab,
Mm-hmm.
but until today is 22,000 cases.
22 what?
But, uh,
Sorry, I didn't get it. What?
due to the fact that I feel a bit worried that I'm saying the wrong thing, I'm going to see the data first.
Yeah.
Indonesia coronavirus, 22,271 cases
Mm-hmm.
until today, and 1,372 deaths. And the number of tests, actually, we still don't do a screening test for the all people in here. So we
Yeah,
only
but
do
when maybe someone came with the symptoms, then then if
yeah, someone either someone came with the symptoms,
hello.
or someone came with the symptoms or without the symptoms, but he or she has experienced what has experienced a contact with the suspected people.
Yeah. So, but all are not positive, isn't that?
Not all of them positive in
So,
the
do
end
you
of the
have any idea
results.
how many of the people are coming with the symptoms?
Really? No.
Yeah. Okay, but there should be a number. I'm sure there are. Maybe you need to search it out, but that's okay. Maybe you can just find it out and add here somewhere in the comment or some under this video after. I mean, after when we are done with this video. Yeah.
Okay, I will, and I will let you know.
So, so let me know about this. That you, right now, where are you in Jakarta
Yeah,
or
I'm
some?
in Jakarta.
Okay. So, the hospital you are working. So, how many patient you get every day?
You mean
I mean,
the
in
patient,
average.
the new
With.
patient came to the emergency
Mm-hmm,
department? I
mm-hmm.
think it varies by the day. So more than 10, more than 15 patients can come every day
Okay.
in 24
So,
hours, and and they are not from the same source. Like people came directly from their home with the symptoms and came to the emergency room. No, not only that, but there is like that, but also there is some others like the patients who precedingly came to the another hospital, and
mm-hmm.
that another hospital referred to our hospital, because the center of the referral hospital is my hospital now.
Okay.
So,
So, what about the situation for people, for some other diseases? For example, a patient with a stroke or heart failure or any other, like an
well,
accident. So, where
yeah.
do they go, and how the hospitals are handling this? Can you share something about this?
That question needs a very long answer, Tarana. But let me answer that.
Okay,
Uh,
sure.
the the comorbidities. I said that comorbidities. I know you. Oh my God! Sorry, it's falling out. The the comorbidities like diabetes mellitus or heart failure or also
Mm-hmm.
stroke. Sometimes they came as also suspected patients for COVID due to that comorbidities. Because of that
Mm-hmm.
comorbidity, so the person is more prone to the
Mm-hmm.
COVID.
Mm-hmm.
But some others don't. Some others came just for control of the disease, including patients with lung cancer.
Mm-hmm.
Uh, we still do a chemotherapy for cancer, and we still accept patients with stroke or heart failure and take care of them. But mostly we refer. So as a referral hospital, we also refer their patient to another hospital, which are not center for COVID.
Okay.
I think that decision can make sense to me, because if you have comorbidity, Tarana, then you are mixed with COVID patients.
Mm.
It's a very high risk for them,
Yeah.
right?
Yeah.
So we don't want that.
Mm-hmm.
I think that's the biggest consideration why we also choose to refer the patients to another hospital.
So, when a patient is coming in the emergency unit in your hospital, so you don't know if this person is COVID positive or negative. So, how do you?
Sometimes yes, sometimes not. Because
Oh,
sometimes not, sometimes yes. Why
okay,
sometimes yes? Uh, some of the patients are referred to our hospital
yeah,
already with the results of
okay,
swab,
yeah,
or
yeah.
or at least rapid test.
Mm-hmm.
So that is why here we separated them. We separate the isolation room. The isolation room is again separated by into two. COVID positive and still suspected.
So you
That's
just mentioned the rapid test. So are you doing this rapid test or the PCR only?
both.
So do
Both.
you, so are you seeing any false negative or false positive for this
Yeah.
rapid test?
Yeah, that's the fact. That's the fact. But the government has decided that the gold standard for the diagnosis making is from based on the swab, not from the rapid
Okay,
test.
okay, okay. So
Yeah.
do you have any dedicated center for testing?
Yeah.
And
Only
how
one
many?
center.
Only one
Only
center.
on only one center. Well, actually, there is other center, but for the government, one center is a center for not disease control. No, it's actually center for research. So they do
Okay.
PCR in there.
And is it free of cost?
It's a government responsibility, so they don't take money from out of it.
Any charge? Yeah, but
No.
how about the private one? Are the private hospitals are doing this test? Hospital or any diagnostic center or anything?
In my case, in Persahabatan Hospital, the hospital that I'm working on, they
Mm-hmm.
don't do swab, but they
Mm-hmm.
do rapid tests.
Okay.
How about in Bangladesh, Tarana? It's also
No,
one
there.
center for a swab or.
Yeah, one center it was initially. So from
Hmm.
the beginning, it was only one center that was doing all the testing, and it was only for PCR. But then, as the cases were increasing, so we felt that we need more test centers. But it is so difficult to set up PCR testing center because it is not only about a machine; it's also related to a technician who must have some, basic knowledge about doing this PCR. We have done
Okay.
PCR in Netherlands, isn't
We
that?
have done PCR in Netherlands, yeah.
Yeah, yeah,
We have.
exactly. So,
Well, Tarana, yeah. I want to ask you, I mean, in your country, based on your government definitions of a positive COVID, they say the positive cases based on a rapid test or swab, or you must
no,
have
it's
two
only swab. No rapid test is
only swab.
being done
Okay.
here. Although someone from our pharmaceuticals, they said they invented a rapid test kit. But there is something going on of the approval of this test because they don't know if it is going to make many false positive cases or not, something like this. So it's still under, testing whether we can use these or not. But I think I saw many news from Australia that they are saying they don't approve, and WHO also don't approve the rapid test. So no, we are not doing any rapid test here.
You still remember about the IgM, IgG, right? About the B cell and T cell that's here in the Netherlands, and also
Sure, I do.
yeah. I think that
So,
why why
are you
what
going to talk about
I'm
that?
not I'm not going to mock you. No, I'm not going to mock you. Okay, so
Yeah, I
so
remember
stay calm.
someday. Yeah. No, it's okay. You can mock about me because sometimes I also mock about myself, so it's okay.
Good, good. I'm so glad that we are still the same stupid. That's
Yeah.
that's a
No,
very
I
good
have
news.
changed. You are
Really,
still the stupid one, but I have changed a lot. I am the
really.
smart
Oh
one
my
now.
god, that's not a good news for me. Well, okay.
Yeah.
About the rapid test, you asked me once about the any false positive or false negative. I really think that's really really related to the IgM and IgG, Taran. I remember that we
Hmm.
need days until weeks to have IgM.
Exactly.
Yeah.
Hmm.
So the a matter of timing is really important in doing rapid tests, and that's I think that's something that uncontrollable. We cannot control
Yeah.
people when they go for a rapid test, and
Yeah.
so when
So this
they
is, and in between they might have infected some family members, or if they have been going somewhere, they are already infecting people because there is possibility that you can asymptomatically you can infect people,
yeah.
isn't that? So the antibody will be produced like after 10 days, but 10 those days are already you did all the disaster. So there, I don't understand that what is the use of rapid test. So can you just tell me why in Indonesia you are using this rapid test if you are also saying that it's making many false positive?
I think because that was the government decision to
Mm.
buy or to provide a rapid test. The government, I mean, the government only provide that, but not will use that as a gold standard of diagnosis to
Okay.
confirm COVID. But if you ask me why the government in Indonesia buy that rapid test, I believe they have a consideration, but I don't know what. Maybe they think about the limitations of the time, or or a time effective or something, or just for screening. I don't know.
So you are importing these kits from where? China?
If I'm not mistaken, yes, they imported it.
Okay. Okay.
It's
Okay. So
it's
I was just
I don't-
wondering.
hmm.
Yeah. No, no, you can just go on, please.
No, don't post, Tarana. I hate awkward moment. I hate awkward silence. So
Yeah.
I love I love to hear you. I love to hear your voice. So please ask me anything. So no matter if I can answer your question or not, it doesn't matter, right?
Yeah. I just want you to say, shut up. Just like before, you remember those days.
I remember those days. You always say that to me. You always ask me to shut up. It means that I'm too talkative to you. I was too talkative to you, right? At that old days, and
You was? No, you still are. Yeah, you are.
you're very, you're such a witch, such a witch, really.
Which? So I
God.
really want to, I one thing I will never forget about you and how
Hmm.
you used to annoy your teacher with the name, the R letter. You could not pronounce the R. So can you tell a little bit about that incident?
You want
Tell
to
me.
embrace me, you know? You want to embrace me in
No,
my own video. You really want to embrace me, Tarana. Oh my god.
no,
No, I'm not going
no,
to do that.
no. Please tell everyone. People should know the inner you.
Okay, people, I was in junior high school. And I was in junior high school, and I have one teacher who literally could not pronounce R as R. And and one day he asked me to do something that I refused to do. That I don't want to do what he wants me to do. And I replied with confidence, I'm sorry, sir, I'm not to do that. I'm not going to do that unless you tell me, Astari, please, you please do that. And then he was really insulted. I really was about uh, to fail my final exam,
And then he
and
called
until
your mom.
and then he called my mom. And then my mom came to the school and accepting his complaints about me. And then my and then my mom confirmed that, is that true? Was that really you did that? And I said, yeah, I did that. And then she slapped me already. Oh my god, that was the that was the only period
Yeah.
during my whole life my mom slapped me. Actually,
Okay. She should have done
thank
it
you,
more
Tarana, for
often.
reminding me. My
She should
god.
have done it
So now,
more often.
no, I'm no, I'm going. No, I want to ask you. Now you're happy, right? Now
I'm so
you're
happy.
happy.
I'm so
Yeah,
happy.
thanks.
Okay, so I want to talk about one sensitive thing, Astari. Since you are a mom now, so how do you handle this? Because you are also handling this COVID 19 positive people, and
Yeah.
then how are you, isolating yourself from your kid, and what are the challenges, both emotionally, physically, everything you are facing socially.
Yeah.
Can you talk a little about this?
So thank you that you asked me that. And I
Yeah.
think during this session that this one will be the only thing I really, really take this the most serious thing. Well, it's really hard for me to say, Tarana, about being a parent during this COVID. You know that
Mm-hmm.
my baby Arthur, he's still just 15 months old, and my heart is full of a feeling of worry. I'm worrying about him every day, and I couldn't make it with my mental health normally every
Mm-hmm.
day if he stays with me here in the same house.
Okay.
So I and my husband made a very hard decision. We sent my baby to my parents' house in other city to save
Okay.
to protect him. So yes, you can ask me. So I haven't met him for 3 months. Can you imagine
That's
that?
so sad. That's so sad.
Yeah.
But you are doing an amazing job, Astari, especially. I mean, those doctors, all the doctors, and but especially those are with the respiratory disease, working in the
Thank you.
respiratory disease units. You are the frontliner fighting these. You are the soldier. So I really want to say thank you, and we are really grateful
Thank
around the
you.
world for all the healthcare people who are doing their
Thank
best
you.
in this pandemic. I mean, I really don't. I really can't tell you. I mean, I don't know how to feel it and how to express this, but how difficult it is for people like you. Like you have to keep your child away because
Yeah.
you chose to dedicate your life to give the service to the people who are having this
Thanks.
COVID-19. So I'm
Thank you.
sure people from your country and everyone, your family and everywhere, they will understand and they will always appreciate all these sacrifices, because some
Yeah.
of these are not
Thanks.
possible to, recover, get back to these, because you are missing this very important time with your
Yeah.
children. And
Yes.
also, we don't know when this pandemic is going to
Will
end.
end. Yeah.
Yeah.
We don't know. And you
So,
know, Tarana, the case like me, having a long distance relationship with baby,
mm,
is not the only a mom struggling during this pandemic. Because in fact,
mhm.
if you hear my story, you will oh so sad. You are having a long distance relationship, Tari, with your baby to protect him. But can you imagine, even a
Mhm.
mom
Mhm.
without a long distance relationship with their babies by now is also struggling, Tarana. Can you imagine
Yeah.
if you were in
Yeah.
their position? Every
Mhm.
time you came back from the hospital, you came back from work, and then your children wants to hug you or something like that, then
Mhm.
you refuse to do that.
Yeah, I know it's
That's
really
sad.
difficult.
That's really sad.
So difficult.
Very difficult. Yeah.
So this also reminded me one thing. So
Hmm.
when you were in Netherlands, you said
Hmm.
you will name your son after or daughter, whatever it is, after me. So I don't see anywhere my name in his name. Why
the
is
fact
this?
is the fact is my baby is a boy,
So
you know.
what? It
So
doesn't matter. Do you know the meaning of Tarana? Do you know the meaning
no,
of Tarana? This is
no.
something related to music. So it doesn't matter. Music has no gender.
So please now, okay, now let me think and let me
I
feel.
know!
So
Why
let
you
me
are
feel
going
if
to
I
ask?
so let me feel if I named my baby Muhammad Arthur Tarana or Muhammad Tarana Arthur. So what can I call him by name?
Arthur, but at least my name would be there. You didn't keep your promise.
I will keep my promise. You wait until I have my baby girl, okay? You
Okay.
wait.
Then keep producing children until you get a girl, okay?
But not during this pandemic, okay? Not during this pandemic.
Okay. You
Okay,
say this to
Tarana, to
your
some
husband, not to me.
Tarana.
Yeah.
Yeah, right. You're right.
Yeah.
Tana, to sum up, please.
Yeah.
Do you have any words for people in Indonesia, considering that your background, you are a pharmacist, you researcher, you understand public health, and we talk about the Vietnamese people who succeeded with what they did. Uh, do you have any message for us?
I think the only message right now is to really take it seriously. I mean, there's no way to take it like, okay, it's been 2 months, 3 months, so how long I can just confine myself inside a room or not to go back to the normal life. So I think for even this is also very open now that WHO and in many other researches and other articles they are talking about that life will not go back to normal like before so easily. It may take 2 3 years. So there's no point of taking it lightly. So whoever
Okay.
watching or whoever you are, you just talk to your family member and just get used to with this new lifestyle, washing hand, using face mask and everything, and trying to avoid crowds as much as possible just to do the most essential things. So, and I also try to say this to everyone, my family, people I know, my relatives, friends, um, and also most importantly those people, I think not much educated, so they don't understand what is happening
Yeah.
in real. So for them, just to make it, I mean, in your local language, just make it easier for them to understand why it is important for them to keep a distance, not to hug,
So the
not
point is,
to
this is serious. So please take it seriously. That's the point,
yeah,
right?
exactly.
This is
Yeah.
serious. Thank you very
Yes,
much.
you're
I
welcome,
want you
and
to
thank you
stay
so
healthy,
much.
Tarana. Yeah,
Yeah, and
thank you
I,
so much for your time.
yeah,
Thank you so
same to
much for
you.
your
And
time. I really,
I really
sorry?
appreciate that the work you are doing. I
Thank
appreciate
you.
the work you are doing as a medical doctor, because this is something, I mean, even though we are, as a public health researcher, we are writing papers, we are
You
trying
know,
to, you know, highlight the problems, but you are the one who are working from the front line. So it's my heartfelt thank
thanks.
you to all the doctors out there and the healthcare workers.
Shall I also say something to you and the people in your country?
Of course, I was about to ask you that if you
Yeah.
have any message for people in my country.
Yeah. I want to say to to people in your country, maybe also people in my country. When the
Hmm.
first time this pandemic came up, I thought I thought we medical doctor nurses are the frontliner during this pandemic, but actually now I realize it is actually not. The real frontliner are the people of this country, all of the people of this country. So please stop thinking that we are the frontliners. So actually, it's you
Okay.
all are the frontliner.
Yeah.
Please send this message, and without them obeying the rule, without them obeying the government advice, I think this pandemic won't get off,
Hmm.
and that's horrible.
Yes. Yeah, thank you. I would also want to. I was also just saying in the very beginning that it's not from the government side. It's also from the how, as
People side,
people, people said how we are reacting to this pandemic and all the
yeah,
laws and everything.
yeah.
Yeah.
So many people lost the job during this pandemic. So many people
Yes.
lost their
Yeah.
contact, and yeah,
Hmm.
I think
Yeah,
many new problems comes up during this pandemic.
yeah, many, and
The prob
also I think
the problem that we never even could imagine can happen happened during these pandemics.
yeah, yeah, exactly. Yeah,
Yeah,
many domestic violence are really popping out now. Severe one, not only
yeah,
in Bangladesh but also around the world. I was reading an article on that. So
mm,
it's because it's so difficult for the people, especially women or men, whatever, both. So those are those who needs to confine themselves inside the home, but then inside home they are facing the man or woman both, and then facing all this violence. So this is one important thing. And also not going out doing the physical exercise. So we are actually, I mean, for myself, I lost my body clock already. I'm trying my best to get back to my normal body clock. So yeah, I mean, many things has, I mean, I
Sorry,
don't
if you
know how
say
to, I mean,
sorry if you say body clock, you means this your circadian rhythm or something like that.
yeah,
You
like
said that
my
body.
sleep cycle, my sleep cycle.
Okay.
Yeah, so
Okay. Why?
I
Why? Because of the WFA, WFH. You mean?
yeah, yeah.
Okay.
I think this is one good reason because I don't have any, reason to wake up very early to get to find my transport Uber or something and something like that. So now it's more relaxed and also, so tensed about the current situation. It takes time to go to sleep and like always so
Yeah.
stressful. So everything has changed. And also we had this, with the Ramadan. So that was also important why I could not maintain my sleep cycle, the normal sleep cycle. So since now it's Ramadan is end, so I hope I'll go back.
Okay. Tarana, please send my regard to your family and your mother. I hope she's doing okay.
Yeah.
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 And I also hope you are also doing okay. Please continue to do your great job as a researcher, and please send me any good news about what happened in your country. And I really
Yeah.
hope
Sure.
Allah will give us that good news soon, also for my
Yeah, I
country.
hope so. Yeah, I hope so. And also
Yeah.
you send my regards to your mom and your
Okay.
husband, and also and say hi to Arthur. I haven't met him
Thank you.
yet, but I really looking forward to
Yeah,
meet
he
him
should meet
soon.
you. Yeah, he should meet you.
Yeah, after
You
this
should
pandemic.
you should visit Indonesia. You don't only think about Bali, you think about me, you know? So you should visit this
Really?
country.
Really?
Yes. Yes.
I don't think so. I should think about Bali, and then you should come and join me in Bali with your family.
Hopefully this
And I
pandemic
already
will end
said,
soon. Yeah.
yeah,
I really hope this pandemic will end soon, and we
yeah,
can make that
yeah,
possible for us.
yeah.
Yeah.
I hope so. Together we will make it.
Okay. Okay, Tarana. Thank you so
Yeah, it
much
was
for
so
your
nice
time.
to catch up. Yeah, same to
So
you.
nice to talk to you. Bye.
Bye, Tata. Talk to you soon.
Talk to you soon.